afternoon again. Praise the Lord. I can't believe we've been in this corner of Kokomemle. No matter what they change, I still will say Fanufa Street, huh?
Joy 99.7 FM.
30 years rocking your world. Yeah, when they were sitting, we stood, huh? They stood, we set the standards. After that, we were simply outstanding.
Joy 99.7 FM.
My name is Nortey by nature. Mr. Michael Kumoji on the Fertilizer Road. I met you yesterday, right? And you called me Nortey by nature. I insist. It is Nortey by nature. Welcome aboard. And like I said, and like MJ said, 30 years ago we came and we rocked your world. We turned everything upside down, redefined everything. So MJ, tell him, right?
Joy 99.7 FM.
Goodness gracious. Oh, that girl fine, man. Look at the she's
Joy 99.7 FM.
Oh, she's off the hook.
She looks good. You're right.
MJ and Chris Tucker, right?
Chris, I can
Can't get in that girl, Mike. I guarantee you can't get that girl.
watch me get that girl.
I bet you never land. You can't.
I can get
Joy 99.7 FM.
Excuse me while I dance. When I get in my MJ mood, trouble.
dark child. I like that.
Joy 99.7 FM. Joy 99.7 FM.
My life will never be the same. 'Cause girl, you came and changed the way I want, the way I do. I cannot explain.
Can't explain.
The things I feel for you. But girl, you know it's true. Stay with me, fulfill my dreams, and I'll be all you need. Feels so right, girl. You're the perfect love of my life. Feels like I finally found us. Perfect love is fine. Come on, girl. My world, you know you did. And everything I wanna give. There is love who we can find. The one like you come find. My world, you know you did. And everything I wanna give. There is love who we can find. The one like you come find. Time I knew that love would bring this happiness I'm in. I tried to keep my sanity. I waited patiently. Girl, you know it seems my life is so complete. I love this truth because of you. You're doing what you do. Think that I'll find the perfect love. I search for all my life. Think I'd find such a perfect love that's awesomely so right. My world, you know you did. Everything I wanna give. There is love who we can find. The one like you to come find. My world, you know you did. Everything I wanna give. There is love who we can find. The one like you to come find. My world, you know you did.
Yeah, we rocked your world, right? Ultimate Health on Joy 99.7 FM.
The one like you to come find.
I know you have your experience. I have my experience. Still 99.7 FM. Talking about malaria ending with you and I.
Joy 99.7 FM.
All right, let me pretend I'm serious, right? Nortey by nature. I walked in here somewhere 2002, Did about a 6-month stint on the morning show. Crossed over, introduced Ultimate Health 2003. I should be tired, but for you, we are here. In the studio, I have... Last week, I promised to be the mosquito that will bite them. So I've got Dr. Louisa Mate, right? Metropolitan Director of Health, Greater Accra. Next to her, the Capo, Chief Lele Kudolo of the Malaria Elimination Program, consultant physician specialist, and the head of the National Malaria Elimination Program, Dr. Kezia Malm. Ladies, you're welcome.
Thank you.
Yeah, I was jamming small, Have you caught the joy fever yet?
Yeah.
There's no elimination program for the joy fever, right? Or you guys have something like that in the strategy?
No, we don't want
We
to.
actually have a song, actually.
A malaria song
yes.
for joy?
Yes.
Hey.
So we'll let you
What does it
play
go like? Zzz?
It's like
Eh.
eliminate malaria.
All right, but we're here. We've been here for a while, and we're happy to have you. Last week we started trying to break down this whole strategy, which says we can be audacious enough to eliminate malaria. Other countries have done it. I'll go through some of the lists. They did wonderful things, but China, it was from 1950s, 60s, somewhere, all the way, until they were finally certified by the WHO. Right. We say we are getting there. I know you're doing lots of stuff. I know in this period, in fact, as I speak, you are rolling out and giving out insecticide treated nets. Long lasting.
Insecticide treated net.
Right. You're doing that right now as I speak.
Yes.
Yeah?
Yes.
And people are collecting.
Yes.
But they had to register before.
Yes.
Louisa.
Yes.
Yeah? What was the plan? What's the program?
So it's we call it the long-lasting insecticide nets campaign.
Okay.
It's a points mass distribution campaign that we do every 5 years, 3 years, every 3 years.
All right.
So it's usually in 2 phases where we register the households.
Okay.
So that we know the actual number
of people in the house.
In the household.
Okay.
And then after that, we take our time and bring the nets that are the amount of people we've registered.
In a sense, that's a bit of a needs assessment. We look at what is out there, the number of nets we need, and then we go grab them and bring them.
Technically.
Okay. So
Perfect.
currently, you are delivering the nets.
Nets. Yes.
Okay. Dr. Malm, is that all you do, deliver?
We do a lot. We do a lot.
You do postnatal as well.
As a country, we have interventions for prevention and we have interventions for managing people who get malaria.
Right.
Even in the prevention, we have the ones looking at the mosquito and we have the ones looking at the parasites.
Okay.
Yes,
Let
quite
me
a
just
number.
pause you there, okay? I want us to stick on this rollout since it's currently ongoing.
Right.
What I meant by, is that all you do deliver? Because I was thinking, do you hang the nets for the people? Do you make sure, you just give them nets and then won't they go sell them?
So we give the nets and we educate them.
Right, okay.
What we've done to prevent them from selling is that we actually tear the pack.
Okay.
It's when it's in the pack that they can't sell.
Right.
Usually out of the pack,
Okay.
they don't.
Have you written not for sale on it? Because we are stubborn.
It's there, but it doesn't.
We're more
make a
stubborn than the
difference.
mosquito. Ghanaians, yeah?
human beings.
Okay. So there is empirical evidence that shows that the consistent use of these nets has a significant impact.
Yes, it does. It
Right.
does. I mean, in the studies that brought the nets into being, there was a 30% reduction in all-cause mortality.
Okay.
Yes, because it's difficult at the community level to be able to differentiate which death is due to malaria.
Okay.
So the study shows 30%.
Okay.
That's been some years ago, and those nets have been changed over the years.
Okay.
And the current one is also giving us quite significant reductions in malaria deaths.
Okay.
Yes.
Right. I need a net to protect me from a certain day in Maryland. Nortey. Why don't you just stand up and boogie? The dance in the chair isn't dancing. Dede? Shaye. Right. But if you just joined us, Ultimate Health on Joy 99.7 FM, we're talking about malaria and ending it. Yes, there are countries that have no malaria, right? But I do hear that Nigeria and some other people, Congo and things, they are topping the league easily, right? Yeah. So we're going to try and understand what countries have done. Last week, I got into a bit of a tangle with Paul and Louisa in the studio about, stagnant water, piles of refuse and all that, bins and all that. I'll get into that. But we need to understand how a country pushes back. We used to have rollback malaria, right? Yeah. Pushes back. Now we've gone past rolling it back. We want to eliminate it. What's our target date for Ghana?
So, just like you mentioned for China, it's a long process. What we've done is to zone the country. So the first target date is 2028.
All right.
And we are hoping to be able to take 21 districts in Greater Accra to elimination.
Okay.
Then the others will follow. So eventually, and that's how the other countries did it. It's more about shrinking the map of malaria till eventually we get there.
Okay, I know my listeners will ask, and they will ask, right? Why Accra? Or is it that we're shrinking in other regions, or you're just giving us a specific target?
So in determining which districts are due for elimination, we look at the burden of malaria. Greater Accra is the region with the lowest malaria burden.
Okay.
Our parasite prevalence rate, that is, if you take 100 children under 5, you get just one person being positive for malaria.
Okay.
And if you look at the number of cases that are presented to health facilities, Greater Accra, relatively, looking at the population, has the lowest. So we put in a number of factors to be able to zone the country. And these 21 districts were the ones with the lowest burden. We had 1 or 2 districts in other regions, but in terms of feasibility of implementation of interventions, we focus on the 21 districts.
Okay. So that should make it easier for us to sort out Accra.
Yes.
Right?
Yes.
Bit by bit.
Yes.
Okay. So you're saying that, well, if we do a random take, well, we're getting less than how many cases?
One in 100.
1 in 100
Yes.
for children under 5. What's our mortality looking like? How many children under 5 are dying from malaria?
So actually our mortality now that are recorded in the health facilities are really down. Last year we recorded 76 deaths in all our health facilities. If we take it to in terms of rates, we are 0.001% of admitted cases in children under 5 who died.
We'd rather no child died.
Exactly.
Yes.
Okay, it's not that we're celebrating 75 deaths.
We
We're
are
just
not.
saying that it is a significant improvement from where we were.
Yes.
Right? I was seeing 2000s and something way back.
Yes.
I think 2022 I saw 151, and that was not even just restricted to under 5, was it?
Yes, that's the whole country.
That was the whole country.
Yes.
151
Yes.
people lost their lives to malaria.
Yes.
Okay.
And in fact, for deaths, we are really pushing that by 2028 it should be near zero in our health facilities.
Okay. 17 minutes past the hour of 2 on Joy 99.7 FM. If you've just joined us, we're ending malaria. We're serious about it. There are strategies that have empirical scientific backing that work and have worked in other countries, and we are pursuing that. right? Earnestly. I've got the boss of the Malaria Elimination Program, Dr. Kezia Malm, with me, and Louisa Ademki Mate. Yes. She was with us last week. She's the regional director, metro director for health. Oh, but you too, when I say regional, the regional boss is not your friend then. She will bite you. Is it a she?
It's a he
It's
now.
a he. Oh, okay. All right. It's the female mosquitoes we're worried about. All right.
It's
so
your friend.
yeah. Oh, your friend there. Okay. So yeah, if you have any questions, concerns, last week we got a lot of questions about case management, the rapid diagnostic tests. Some people said, Chale, sometimes it says not to know, but you're not feeling fine. And you have been told to wait till it is positive before you treat. And before you can say, Jack, where are you? It has knocked you down. And then it suddenly says positive. We had questions like that about case management, Dr. Malm. So we would like to explain and understand that as well. Some people also said that, hey, they were told it was negative, but they were still put on treatment. Somebody whispered to me that they said that the parasites can hide in the liver somewhere, and then at night they come out for party, right? How do we explain these kinds of variations or discrepancies in outcome when it comes to the rapid diagnostic testing?
So when it comes to using the rapid diagnostic, I always say that look at it as sewing a dress, and I'm a woman, so it's easier for. You just don't walk into any shop and take anything. It's all about giving people quality care.
Okay.
So we say don't just treat, but test. There are a few instances, so let me start. There are a few instances where, due to the very low level of the parasite, we may not be able to pick it. But those instances are few. Most of the time, we are not picking it because the parasites are not there. Generally, if you look at how the malaria parasite behaves, it's at the time that you have the symptoms that the parasite is in the blood.
Okay.
So even for microscopy, that's when we see it. But the rapid diagnostic tech is taking the antigens. So it's not even the parasite, it's part of the parasite.
Right.
So once the parasite is somewhere in the blood, even in the liver, you will still be able to pick the antigens.
Okay.
It is when it is very, very low that we sometimes miss it.
Okay.
What is happening is that there are so many other diseases that look like malaria, that present like malaria. And recently you heard about the dengue fever outbreak. Almost all the people were diagnosed of malaria and they were not getting well even after taking the anti-malaria, because we are so used to malaria being the cause of fever or feeling unwell. 99%, especially if you look at Greater Accra where we see 1% prevalence, most of the cases that we think is malaria are really not malaria. What we want to encourage people, and it's just because we want quality of care and we just don't want to dish out medicines for people unnecessarily. Otherwise, every fever case you take anti-malaria. It's okay to repeat your test if you are still not feeling well. It's about quality care. It's about being treated for what you actually have.
Okay.
And for us also to look for other things. Because if you are still not feeling well and we see that it's not malaria, the onus lies on the health worker to help you find the cause. It could be something else and not malaria, which is starting as malaria.
Okay, great stuff. So we know other countries have been successful and it took them several years. Okay, just as the head of the program, what's our rating? What's our pace like? We are fighting. We are winning some parts of the fight. Okay, but in terms of peer comparison and so, because I see a lot of not so good news and data and statistics when it comes to the sub-region. Okay, how are we doing as Ghana?
Okay, so a few years ago, I don't know if you heard about we being classified as one of the high burdened, high impact countries. So 10 countries in Africa,
Right.
plus one, India, 11 accounted for about 70 to 80% of all malaria in the world. Ghana is part of it. That's not a good place to be.
That's why I'm looking at you like that.
Yes, that's not a good place to
Right.
to be. And at that time, we were somewhere between 4 and 6. We have moved.
Okay.
So last year we are somewhere around 9. So it means when it comes to malaria, we account for a little under 4%.
The whole world.
Yes, of the world. That's significant. That's really significant. So it means there's a lot of work for us to do.
Right.
And I was very happy last week about the enthusiasm. I was telling Louisa when I heard you speaking, because unfortunately sometimes we think malaria is normal. It's been with us forever. What can we do to get
4% of the
yes.
global burden
Yes,
is
that's-
not a joke.
it's not a
I'd
joke.
rather change that to gold. Yeah?
We'll be happy if it was for something good.
Right. So we're still not out of the 10.
No, we are
We're not out of the
We are
10.
not.
Folks, this is serious stuff, okay? There's lots of stuff that has gone on. We switched from the chloroquine to the combination therapies. And if you want to Google, you can go and Google even the artemisinin, where some Chinese somebody did something, found something. But of course, we also knew our plants, right? And we've done a lot of stuff. We've done a lot of education. She's telling us, thankfully, that when it comes to under 5 mortality, Charlie, things are looking better. You could, struggle, pray for a child, and lose that child to malaria, right, Doc?
In fact, it's so sad now because things are getting better. The deaths are not really occurring in those under 5. They are occurring in children 5 to 15. Some of them have never had malaria. So when these people have malaria, it's like we have to run and make sure that they are
Joy
treated. Most unfortunately,
99.7 FM.
especially in Greater Accra, we are losing the children between 5 and 15. And,
Okay.
We've had some really bad stories.
Sad tragedies. Sad
Yes,
ones.
yes,
Okay. Louise, I'm shooting at you now. COVID time, we wanted to flatten the curve, do this, do that, herd immunity. So malaria crowd, why can we not flatten the curve and all of us have immunity? Such that when we are traveling to another country, they're not looking at us with certain eyes and and if we take malaria there, then they'll quarantine us. It's a serious thing.
Yes.
Yeah. So why haven't we? I mean, I bet Coco, maybe even Joy FM. If I've sat here and been bitten by mosquitoes for 30 years, right? Shouldn't I have some immunity?
Well, yes, you actually do have some level of immunity. The way your body would react to malaria parasites now would be very different from somebody who's
Compared
never
to
been.
the homecoming people.
Yes.
The dirty December people and all those
exactly.
people. All right.
Dirty December, yes. So you actually do have some immunity.
I do have some immunity.
You do.
Right.
And all of us who live in Ghana have actually been exposed to the malaria parasite. So we
Okay.
have some level of our body's immune system knows it to a certain degree.
Okay.
Now, the difficulty with malaria, I'm sure Dr. Mam would add more, is that the parasites are...
You guys, when your bosses are in the studio, you're always passing baton. And I
you
pass
must.
the baton. That's why I said I'm shooting at you. Leave your boss alone.
I hear you.
Yeah.
I hear you.
Uh-huh.
So the parasites in itself is they behave differently.
Right.
So today you are able to attack one aspect of it.
Okay.
It changes itself and you have to deal with something else.
Right.
The mosquito in itself also is doing its own thing. Now the parasites, recently we've heard of a new one called the Stephensi that is able to live all through the year. I mean, stay around during rainy season, during dry season, is able to be comfortable in homes and things like that. So because of this nature of the parasites changing itself and acclimatizing very quickly to some of the things that we attack them with, like they becoming resistant to the chemicals that we are using in the net and things like that, it's difficult. So every day there's some continuous research. Every day there's some continuous work, some continuous learning, some different discovery on this one parasite that seems to just know how to hide around and that's where the difficulty is.
All right. So we still have to take serious public health concern when it comes to malaria, right? Despite all the good work we've done. Okay, and we're part of the pivotal work that, should I say, yielded the malaria vaccine. Right? Since 2019, we've been rolling it out small. What's that one looking like? Is it the RTSS and then the something
The
2021?
R21.
R21.
Yes.
Are we rolling out the two?
Yes, we are.
Okay,
we
so
are.
let's share with listeners. Some people didn't quite get it when we said we were part of the trials and all that and so on and so forth. But significantly, there is a malaria vaccine. So, Dr. Mam, share with us, what is a malaria vaccine? What it's supposed to do? And I know this week is also immunization vaccination.
Yes.
African Vaccination Week.
Yeah, right. Okay. So, what is the malaria vaccine? What's it supposed to do?
So,
And why aren't we zapping everybody anyway?
so the malaria vaccine is supposed to help people to be able to withstand the parasite.
Okay.
So that you don't get the effects of the parasite.
Okay.
The vaccine trials was able to show some impact on deaths and severe malaria.
Okay.
So after the trials were done in Ghana, Ghana was part of the countries
Yep.
that did the clinical trials. After the trials, so after showing that it reduces death and it reduces severe
Severity,
malaria,
right.
there were certain indicators that we needed a bit more clarity on, because it was done, the trials are done in a very controlled
Yeah.
setting. So we went into a pilot, and there was still 3 countries and Ghana was part, where we looked at, is it really in the normal everyday life, if it's in routine immunization, is it really reducing the deaths that we saw? Is it really reducing the severe malaria? Are we seeing any side effects? What happened was that in the trial, we didn't get, when you're doing studies,
Yeah.
a bit into epidemiology,
Yeah,
you need a
th-
certain
no, you're
number,
welcome.
a certain number of cases to be able to answer a question.
Right.
So we were not able to answer some questions well in terms of side effects. So we needed a larger pool. So we had to ask the question, are we seeing these side effects in the larger pool? And that was why the pilot came.
Yeah.
And that was for 2 years. That's the one that started in
Yeah.
2019. So after the 2
In
years,
restricted districts
in restricted
in
districts,
certain
in
regions.
certain regions.
Okay.
In Ghana, we did
Don't
about
worry, Doc. My listeners are discerning, so don't worry if you're getting too technical, okay? I'll dilute to taste.
Thank you.
But I want people to understand how we tested it and why we're not doing. That's why I said, why are we not zapping everybody?
Okay.
All right. So we're breaking it down so they understand. We have a vaccine. We've tested it. We've expanded the test or the pilot and so on and so forth.
Good.
But these are the reasons so that they understand. Otherwise, they will get me. Yeah.
All right. So the vaccine was tried in children under, generally vaccines are more common in younger children.
Right.
It was done in children under 5 because they are the most affected. And at that time, the vaccine was developed for them. And the trials were done in them.
Okay.
And the trials showed that we needed 4 doses to be given to the child before the age of 2.
Right.
So we tried it, we tweaked a bit of the timing to make sure that it conforms to the existing immunization schedule so that it's easier for mothers to, or caregivers.
So in a sense, we put it in our EPI.
Yes.
The expanded program on immunization.
Exactly.
Right.
Exactly.
For the specific designated regions or pilot sites.
Yes.
Okay,
Yes.
great.
So we started from 42 for the pilot. And once we finished the pilot and we realized that it was successful,
Okay.
we then expanded to we had some control districts. So we looked at these control districts to compare to see
Just let's explain. 42 is districts.
districts
Districts
in 7
in
regions.
7 regions.
Yes.
Okay. All right. So that we don't lose them. They'll think 42 children under 5.
No.
All right. So let's stick with that. Okay.
I'll get the exact numbers
Yeah,
of
no worries,
children.
no worries,
yes.
yeah.
But in 7 districts, we selected 42. So the children who went for child welfare clinics
Okay.
received these vaccines.
Right.
After the pilot of 2 years, was expanded to the other districts in these 7 districts.
Okay. 7 regions.
regions.
So when you say child welfare clinics, we're talking what people would normally say weighing.
Weighing,
Right?
yes.
Let's use our language. Weighing. All right.
Weighing.
Great
Children
stuff.
were going
Yeah.
for weighing
Right.
because it was put as part of the general immunization.
Okay. Could you, as a parent of such a child, is it by, do you need consent, or having integrated it into our EPI, would it be offered? What was the response and the acceptance?
So generally, just like any immunization, when you go to the hospital, you are advised, you are coached,
Okay.
and then they give it to you.
Okay.
It is not mandatory.
It's not by force.
It's not by force.
Okay.
But we really, really encourage people to take it. And in fact, one of our fears for the malaria vaccine was that the fourth one had to be taken in the second year of life.
Because we're doing 6, 7, 9,
and 18.
and 18 months.
Yes.
Okay. Right. You see, I've chewed the thing. Charlie, being a small low. All I need is a little glass of something. But don't tell anybody. Then everything I learn sticks. Okay. But if you just joined us, 33 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living, this and every Sunday. When I started, I used to do it on a Tuesday afternoon. But before me, you might remember Doreen used to do Fun Yogo Medical Beat. Mado, Charlie, Tete, yeah. So we've come a long way. 30 years on, we are still, looking after your health and well-being and entertaining you and being naughty in between, right? Now we are more interactive, because when we started, we are analog. A producer will be, kneeling behind me and take an actual phone call. I say, Jojo from Kaswa. Then I put Jojo on the line. We've come a long way. We are interactive, and I forgot that you can see me. Dede was complaining about my dancing in my chair because she can see me. We are now multimedia. You people never noticed when we transition from analog to digital. We've done a lot of things in 30 years, alongside, of course, the developments in telecoms and digital and broadcasting and all that. So we're here and we're still doing the stuff. If you have any questions, concerns, I'm going to activate the phone lines. 030-221-6541. 030-221-6541. WhatsApp is 055-11-11-997. We're seriously seeking to end malaria. I've got the couples in the studio. At some point I'll ask them, do coils work at all? All those things that people are making money, but are they really doing anything to the mosquito? And will the doctors tell us? But my phone line is 030-221-6541. Malaria ends with us, you and I. The head of the program, Dr. Kezia Mam, is in the studio, and another female mosquito, Dr. Louisa Mate. They're all here, and Ziggy has the spray. Just in case they get out their chairs and they're coming towards me. But yes, so 6, 7 months, 9 months, and 18 months, right? Yes. We're giving the malaria vaccine in selected regions, in selected districts. Yes. Okay, we've had good success and we're learning a lot about it. Right, okay.
So after the expansion to all the districts in the 7 regions, it became available to the rest of the world. And we also...
we were the first, weren't we?
Yes, Ghana, Malawi, and Kenya.
Yeah. And some people, I remember radio station right here. Why are they trusting it with that? But we were part of developing it. Yes. And you see, when you look at Gavi, the global vaccine alliance, and all that, and the help we get from them. When you hear the stuff and the vaccine hesitancy, Charlie, you haven't lost a child to malaria.
And Nortey always says, because we no more see those diseases that the vaccines have helped us eliminate. I don't know how many people have seen measles.
And you travel and your yellow card cries some way. Like you have to hold it because some people will flex you at the airport. But generally now you can breathe.
Yes.
And people don't
fever, we don't see measles, whooping cough, all those things. I mean, we don't see them.
Okay. So malaria vaccine is good news.
Yes.
It's working for us.
It's working for us.
Right.
Currently, we've expanded to 135 districts. And the good thing is that there are trials that are going on in Burkina Faso to see how the vaccine will work in the older population, in women, in the childbearing age. So I'm quite happy. There's hope for the future.
Okay. Now, we were concerned about pregnant women, right? They formed a very critical statistic that we looked at, we monitored. What's the situation for them? What are we doing for them? And how's that going?
So for the pregnant women, we still offer them intermittent preventive therapy for malaria. And then also the long-lasting insecticide nets that we distribute to the pregnant women when they register at antenatal.
Right.
So for them, we are looking at two things: how to prevent the mosquito from biting them, which is the LLINs that we distribute to them, and then we also give them.
It's no longer anybody.
For fever.
Yeah, they say that if people look at you, the
A
mother
certain
and your
way.
child, a certain way, your child will die. Right.
Well, we don't see that one.
Okay. That one too is science and electronics.
Oh well.
I mean,
Okay.
these myths are
The
still
myths are
available,
strong.
yes, in certain areas. So you need to work with the
With them.
community.
Right.
Yes.
Okay.
So we give them the nets, and as well we give them the intermittent treatments.
Okay.
Preventive treatment for malaria in pregnancy, what we call the IPT.
Right.
And that one, it's actually giving them medications in pregnancy to prevent them from getting overt malaria.
Right.
So usually we.
So do they have a say in that? Do they have a choice? Is it mandatory, compulsory?
They actually do have a lot of say in that.
Really?
Because it's medicines. So
Okay.
once we are giving them, we are offering you something in the hospital, you have the right to
I
ask
can't
your
tell you
questions.
that. Also, my pastor said,
You can ask all your questions.
can I refuse?
You can't actually refuse. And
Okay.
we actually have situations where, even with the nets, we have some of the mothers refusing. And we've come up with
99.7
interesting ways of collecting that data and finding out why. Because we have forms we call the refusal forms.
Right.
So we give it to the woman after counseling, further counseling and discussing with her, why don't you want to take it? And then we also give you a document to actually fill out your
Okay.
reasons.
Great.
Same with even the medications that we give.
Okay.
So once somebody has issues, it doesn't mean, oh, she doesn't want it, then just go.
Okay.
We want to know why.
Why?
We want to talk to you about why.
counseling will take place.
Exactly. And then if you
Education.
still insist, we ask you to document why. And then we take it around, because this is information for us. Once it's medication,
We need that
We
information.
need that information. But that intervention is there for pregnant women.
Okay.
And it's still in action
All right.
for the pregnant women.
Great stuff. If you have any questions, it's 40 minutes past the hour of 2. Ziggy and I are going to chop some mutu, so after 2, you won't get us. Call now, 030-221-6541. I've got the malaria song somewhere up here, starring some mosquitoes and a few members of staff, right? We'll play that as well. We're looking at ending malaria. We want to understand all the pillars of Ghana's strategy, right? And I've got the guest in the studio, Dr. Louisa Mate. She heads Metro Health here in Greater Accra. Then the overall couple, Dr. Kezia Malm, heads the National Malaria Elimination Program. We're looking at some of the strategies, what we need to do. Last week we got into a bit of argy-bargy about refuse and stagnant water and all sorts of things that are also breeding the same mosquitoes we are fighting. I don't like looking at the Kole Lagoon. Indeed, I don't want to call it a lagoon. I heard the Greater Accra minister making some big promises for her first, I don't know, 100 or whatever days. Charlie, please, very soon I'm going to start firing. All right? That's not naughty by nature. That's naughty. I will talk about these things because I don't see why certain things should persist across governments. Some things will sit there, people will hand over, or people will lose power, and the thing is still there, right? And people are wearing t-shirts and dancing and calling names and all sorts of binary arguments. So refuse is refuse. And I remember years back when GBC had this, was it Good Morning Accra? Then they go around, was it Drina Jokoto? Oh, I've forgotten the name now. But they report live on GBC. I say, hey, there's this refuse at the Castle Junction, and we want to talk about it. And who was in the studio? And he said, hey, as for that refuse, it's political.
refuse is political.
Ghana, right. My phone line is active 030-221-6541. Malaria, there's interventions for children under 5. There's interventions for pregnant women. There's intervention that encourage you to sleep under. I used to have a fight with that, the under. And whether you are in or under, I don't know. All right. But yes, they're treated nets. Okay. I wonder how prevalent the use is in, for example, boarding schools. All right. These are places where we have people captive. Can we get the practice, the habits integrated, internalized so that people use that over time? JHS, whatever, if it's boarding, if it is this, are they using them? Please, my phone line is active. WhatsApp is 055 11 11 997. Okay, so the women are protected. We have a vaccine, right? Still in restricted mode. Okay, so can I go to a facility and say, I want the vaccine?
If it is happening in your district.
Okay.
So it's not really restricted. It's more of availability. That's why we are rolling according to the burden of malaria.
Okay.
Yes. So in countries where they are able to buy all the vaccines to cover all their districts, all the districts will be covered.
Okay.
And that's our aim eventually.
Okay. Right. Now, you see, when you say according to availability and all that, then I come, yesterday I was going to judge the two of you. I was looking at your flyers and I see all the sponsors underneath. WHO, UNICEF, where are we?
Ghana Health Service is
Ghana Health
usually
Service.
there, yes.
But they're collecting from other people. Is our money in it? How much are we spending on malaria? How much is Ghana spending on malaria? Our own cash.
So Nortey, the difference is that, in fact, all of us here are paid by the government. So in terms of human resource, the government is like 95%.
No, I don't want
in
that
terms of
one.
infrastructure. Now, for malaria specific, government is funding indoor residual spraying in 2 districts. Government buy medicines.
All right.
And government buy some nets.
Okay.
Yes, there's always room for improvement. One of the things that we are pushing for is to ensure that we take ownership of our own elimination efforts.
Exactly. That's my point.
Yes,
That's my
so,
thrust.
yes.
Right? The people are worried about you spreading it across the world, so they will give you money and they will help you. But essentially, it's your problem, right? It's your country. Okay? And when I start going through some of the lists of the countries that have done it, we should be up and doing. Okay? We contributed in now we have a vaccine institute.
Yes.
My brother, big brother, Willie P, Prof. Ampofu, William Ampofu, he's not there. Oh yeah. Anyway, we've been kicked out. We don't like saying it, but yeah. So, but we have an institute. Okay, so we should be doing some of our things for ourselves, hopefully, gradually.
And Nortey, Ghana was the first country to license the new malaria vaccine, the R21, with the hope that we'll be manufacturing it here. Yes, it's a long way off, but so it's something we need to.
Will we be alive?
Oh,
you and I.
hopefully.
We'll be around to see that.
Oh, hopefully,
okay. All right.
hopefully.
Right. How can a deadly disease have a sweet name like malaria? Asemo.
Why is the name sweet?
Is malaria sweet?
I
Please name your daughter malaria. Bro Nortey, the people of Trifo, Ati, Mokwa, and Himang districts in the central region use the nets to what? They probably to cover the palm fruits in the course of processing palm. They should intensify the education there or put in measures to stop the people from doing so. Benjamin, right? Aha. You see, I remember when we brought in the female condom, people were ripping it up and using the ring as bangles. Yeah? Yeah. Yells. Okay. So he's saying that they are using your precious
it's sad.
long-lasting nets to cover palm fruit.
Yes.
Yeah.
Right?
It's
Yeah.
We see that here, even in Accra, we've seen use on aboboyas. The
To cover the refuse?
to cover the refuse. We've seen it in people's farms. And then when we've actually gone out to question some of these things, and people say, oh, these are the torn ones that we had in our houses before, and things like that. And sometimes we don't have the way of verifying whether indeed it's not a new net that they've taken in. But they tell us
We're too nice.
it's used ones and things like. So we know that people are using, or let's say second using,
Right.
the nets to do
Which
other
compromises our
things.
protection.
Yeah.
Exactly.
What we're looking at.
Exactly.
Okay.
Exactly.
Somebody's asking, what were the results of the trials? How many people involved in the trial? Nathan, Google, right? Malaria vaccine, Ghana, right? It's all available, and there's so many friends and colleagues and researchers who took part in the development. That's why I'm so passionate about it. Yeah. So when we're doing stuff and people, there's a lot of agibody. Please Google. If it was the latest TikTok right now, or A plus I said this and the AG said this, you will have it. Please Google, and please, before I finish the show, type something back. But it's available, okay?
Yeah.
That is why I got my guest to break it down, what we meant by district and regions, and why it's not, should I say, nationally available, why we are taking our time. There's certain things we want to know. You develop something with a certain sample size and profile. When you want to now apply it universally, you gradually do that in your clinical application to make sure people are safe. Even when we switched from chloroquine to the combination therapy, we had a lot of problems. People were saying the weight of the person, the dosage, and it wasn't easy on the phone lines here. Okay, so I get what you're saying, Nathan, but it is available. I'll see how Ziggy and myself can do something, put it on my Joy Online or whatever, but it's available, right? And it's been there, and we started rolling this thing out in 2019, okay? We're in 2025, right? But there's data. Do you want to say anything to what he said about the trials, the results, key findings?
So
perhaps?
off my head, those now are so old that I've forgotten. But currently, if we look at our data, those that we started with the pilot, we say they are the phase.
Right.
We are seeing 45% reduction in severe malaria cases.
Can you hit on that a bit? Because when we say severe malaria, people just malaria, right? But the complicated or severe malaria is something we really need to bring down.
Yes.
What's that?
So the complicated or severe ones are when you have symptoms which are worse, such that you need to be admitted, and it can stem from cerebral malaria.
Yeah.
I was torn between saying that but sometimes convulsions, sometimes you get
Coca-Cola urine.
Okay.
Hey, we are not supposed to use Coca-Cola
Coca-Cola is
because
not amused.
it's not amused. Yes. So
Dark urine.
dark urine.
Dark
Yes. Dark urine. Sometimes they vomit
Can we say
consistently.
urine? Okay. sorry.
That
It's
urine
dark
is
colored
fine.
urine.
All right.
They vomit consistently and
Okay.
they lose a lot of. So if you have a child with malaria and he's vomited more than 4 times in a day,
That is
it's
serious,
that severe malaria.
significant.
Yes,
Move
yes.
to a facility. Pronto.
Pronto.
All right. Okay. Hi, Nortey. Listening to you talking on malaria, you mentioned mosquito nets, and my whole family sleeps under mosquito nets. We have never reported to the hospital with malaria, so it saves. And the argument of you can't breathe, you feel hot, it's not nice to have sex in it. All right. Well, I've had 3 children from sleeping under the net. Now here you go. There you go. There you go. In the net. Yes, we shall multiply. Okay. And they came to sleep under it after I produced them there for over 10 years. This is from Michael in Spintex. I mean, what better testimony do you want than this?
Thank you,
Yeah.
Michael.
Michael, Charlie, Tuaso. Right? But yes, the net works, and when you get it, and please, can we emphasize this or clarify? You're giving out the nets for free.
For free.
Yeah.
Free.
Free.
Proper free.
Yeah.
Yes.
Not that later we'll pay a tax for it too.
No.
It's free.
Free
Okay.
through this
Free
campaign
nets.
now in
Okay.
Greater Accra.
And it's from the it ends on the 6th.
to the 6th.
So
So it started on Thursday
okay.
to Tuesday.
All right.
Friday to Tuesday.
And you'll only get
Friday
it
to Tuesday.
if your house was registered.
Yes.
Your household was registered.
Registered, yes.
Okay. All right. All right. If you have questions, Charlie, what's happening to my phone line? Oh, because today I'm high. Eh? All right. Don't worry. Right. What else is up there, out there on my line? Hey, where did all these people? Okay, they were before me. Let me jump them. Somebody's sending me good evening. Bibi Aboko. All right, we're talking malaria, how to end it, the strategies. We've got vaccines. We talked about the nets. We've talked about. Should we go back into this, the environmental aspect of it?
Yeah.
I mean, it's serious. It's a big headache, right?
Yes.
We're paying taxes. We're doing things. Louisa tells me they'll come and check stagnant water in my area, draw a line around it, and come and spray it and all that. Is that seriously? I mean, what kind of muscle do we need, resource, personnel, and all that to really make that impactful as a pillar of our response?
Nortey, if you mentioned other countries that have eliminated malaria.
Yes.
It wasn't done by the Ministry of Health alone. We need the other ministries to come on
Call
board.
their names.
Local government. We need our chiefs. You were
They'll start
talking
calling
about.
me.
We're talking about the abuse of the nets.
Yeah.
Dr. Mate here can't. I mean, the best she would do is
Mate.
educate. Mate.
Thank you.
Thank you. The best she would do is educate the people, talk to her security council, but she hasn't got the power to be able to go and arrest somebody abusing the net.
Right.
But if there are bylaws in the community, then security services can use that as they can enforce that.
Okay.
So we really need everybody on board. That's why I was happy to hear you, because the media is talking about it. Our chiefs are talking about it and setting bylaws. The local government is making sure that whatever bylaws are set are enforced. Our security services are enforced. It's a whole society approach.
Right. Is there a coordinated inter-agency, interministerial, whatever, under your elimination program?
In fact,
Because I'm thinking you should head it then when it comes to malaria.
no, it's actually above me, because it's like you said, it's interministerial. It's in a strategic plan now, and
Right.
and I know the president had malaria as a campaign. It's in the manifesto. It's in our strategic plan.
I don't like manifestos. So.
Yes, but I'm hopeful that it's on its way. We are really working with
Manifestos
our
are
minister.
like when you're wooing a girl and then after she's agreed, say, you don't take me to chop ice cream anymore. You say, no, I'm in power now. That time I was campaigning. All right. So when I hear the political side, okay, fine. Elections are over, right? But the agencies and the ministries and the cadres of professionals that are supposed to deliver, right? When I start hitting, they're welcome into the studio, because I hear millions of dollars allocated for sanitation, for example. Somebody tells me they'll make Accra beautiful. Whether you are a Manche or you are a regional minister or whatever, Accra is not beautiful. I'm sorry. All right. And I can take you round. Okay. So if we have money, if district assemblies have money and so on and so forth, and we're not getting it done, then, that's the point I'm making.
and
you see.
half of our malaria problems will be solved.
And
if
malaria is money.
Yes. If we have these
People are selling
issues.
medicines, people are doing this, the coils and things that I said I'll ask you if they work and all that. Let me see if I can stick in your malaria song before I forget about it. I see it here. All right, let me see what it sounds like.
Everybody come around and join this fight. Yeah, let us eliminate malaria. I go, everybody come around
Yeah.
and join this fight.
It's very low.
Yeah, let us eliminate malaria. Come play your part too, no matter who you are. Identify, drain and cover. All breathing
All right, bit of a snack there, but Ziggy says my female mosquitoes in the studio should dance. But this is the malaria song, yeah.
Joy 99.7 FM.
Pregnant women, make sure you go to the clinic early. Make sure you take your OSP medicine to keep your baby safe and keep you as well from malaria. If you feel you have malaria, that's first to be sure. Before you take medicine,
Ensure you take all as advised. Get rid of malaria parasites.
everybody come around and join this fight. Yeah, let us eliminate malaria. Everybody
Come around and join this fight.
Yeah, let us eliminate malaria. Children and pregnant women suffer the most when malaria attacks.
Those of us who are Jama leaders,
Come on.
Hey,
We need to take action.
I tried it,
now.
I tried it.
Let's all join the fight to achieve zero malaria.
Don't die of malaria.
Joy 99.7 FM.
Join this fight. Yeah, let us eliminate malaria. Everybody come around and join this fight. Yeah, let us eliminate malaria.
right, sounds good, huh? Well done.
Thank you.
Well done. It's funky, eh? But I want more. I tried it. You see, if somebody was selling one of the alcoholic beverages, I don't want to mention a name. Yesterday I was teaching and I was telling the students we managed to kick nicotine off everything. You know, tobacco, Charlie, we used to have Embassy Double Do. Can you imagine? Now, zilch. But alcohol is still doing brisk business, right? And the kids know the alcoholic brands, the colors, the dances, everything. And now some of the adverts have a lot of cultural dancing and so please, I'm giving you free consultancy. You see these ones, let's get some audiovisual formation, Bunkosha and Atradi and all those things in there and carry it along. Okay.
We actually tried with some of the influencers. I mean, it didn't work, so we are regrouping.
I saw you guys bring in a very, very, very okay, my dear, plump ambassador, Ohini.
She's done amazing work for us.
Hey, that's why. Okay, I won't say what I was going to say. She told me this morning that she's not well, so I won't go. She's not feeling too well. Get well soon, my dear. But dear, the mosquitoes will like you, pal. because Charlie, me, my trick. I told Louisa Dems last week that I sleep naked, and the mosquito comes in a trap. So I don't get bitten because they are not in this day and age. A human being naked, no. Mosquito won't go near that one. They are educated now.
Naughty. This one is naughty guidelines from
Oh, try it, lah. And they'll look at you. Three of them will pass your ears.
One, if you are sleeping in a net or you have sprayed, you have indoor residual
Of course,
spraying.
you spray your walls. That
Yes,
one is still going on.
Yes,
It works.
It does work.
Is it
very
also
well.
free?
In some parts of the
Some
country.
parts of the country.
Yes.
So you
Well,
come to my house and then you spray the walls.
Yes, not in Greater Accra.
Right. All right.
Upper West, part of Upper East, parts of Savannah, parts of Northern and Northeast,
Okay.
and the Ashanti region.
Right. So we're doing lots of stuff. What I'll do is, Louise, I've started checking the price of bins
Yes.
because she says she has about 70 schools in her under her control. Schools don't have bins.
Yeah.
All right. So that whole behavior, the habit, and all that didn't happen.
Yeah.
Okay. So we need to get serious with some of these things, and then maybe Dr. Malm, if you can shake a few branches, even those above you, and let's see if we can have the coordinated team. Because I mean,
That would
the filth and whatever, I don't see how we're going to get past it. China
we
has
are
how many
bored.
people population? They've eliminated
Yeah.
malaria.
Yeah.
China, okay, we say made in China as if we don't respect it, but they're
But
doing
they do.
wonders. Doing wonders, okay. So if we can get your coordinated committee or team, and we can have those who can't fit in here, we can have them on Zoom, and then my electorate, our discerning listeners of 30 years plus, we'll put the questions to them. We're not collecting refuse. We're having difficulties. We are fighting over refuse collection contracts. Refuse. I mean, look at the Mortuary Road. It's a mountain. It is rubbish, right? Down the road, we have a recycling plant, which itself is overwhelmed. Okay? I know that the church that was on the Kole banks has run away from there because they have also been swallowed by that whole settlement that is now just on the back of the curb there. Right? If there are officials who are in charge of them, tell them a certain Nortey by nature said, yes, we'll be not calling them. Calling them sounds too nice. Yeah, we'll be calling them out. All right. Recently, I noticed the walls of the Udume Cemetery are disappearing. I don't know whether people are stealing the bricks, right? But that is a public health concern. That cemetery is open. Okay, people are crossing it, moving in and out and doing stuff. I don't know what we're doing. We've done another one flyover to another flyover and back to trouble. You land back into the trouble. All right. So I will have you guys back with some of your counterparts, environment, science and technology, AMA. In fact, a friend of mine, a certain Kojofin says, "Oh, Louisa is with me at the AMA." Yeah. He's an old director, he's a mate and a good friend of mine. So thank you very much, ladies. We've learnt a lot, but I think we need to go back. I need to do a program that focuses on the pregnant women again, hit that one again, and then other places and schools. Schools. Okay. Yes, Doc.
And Nortey, I think it's very timely. Very soon we'll be distributing nets in schools. So if we can do this bin, together integrate it, that will be very good.
So if I get money, you'll be my friends.
We are your friends.
Because I can't understand a country that doesn't have bins. Yeah. All right, but we are inviting people for a Black Star experience. Even the Asundre Park, that castle area, please stop. Where the people play football and do all sorts of things. It's mucky. Yeah, I said it. All right. Okay, let me go before I get into trouble so that Ziggy can come and play music. But yeah. We want people to come to our country. We say to bring us revenue. Tourists will come in, and a lot of them see stuff we don't want them to see. I'm not saying every country is cleaner than Ghana, but we can do much better. All right. And I'm hoping we can eliminate malaria. All right. It hasn't ended with us because we are still going to talk about it. But thank you so much, Dr. Kezia Malm. She's the head of the Malaria Elimination Program, and Dr. Louisa Ademiki Mate, right? Head of the Metropolitan Health Directorate, Greater Accra. She has lots of work to do. Schools, she needs bins. We'll see how maybe I can get some of you to sponsor a bin. Ziggy, between you and I, we can do half a bin each, right? One bin from us.
Half
okay?
a bin each.
half a bin. Morning show. We got to mobilize funds for her to have a life-saving surgery. I think it was whole in heart, right? But I hope we can find her, right? So anybody who knows Mr. Ipe, I remember the father. I took pictures. Those days I was so skinny, Charlie. Were we hungry in Ghana?
Nyamia yebi.
Let's stop. But yeah, that's the name, Josephine Ipe. I remember she went to the school behind broadcasting, Canada, back there, Agri Memorial. They have a school there somewhere, right? Let's see if we can find her. But if you've been with us for 30 years, I know you are happy. So I'm going to sign out with Pharrell. Happy, stick and stay. Don't go away. Ziggy is up. My name is Nortey by nature.